Namaste to all of you. Myself, Dr. Navin Chandra Joshi. I am an MD in Ayurveda and postgraduate diploma in yogic sciences. I am working as an associate professor and faculty of Ayurveda, Uttarakhand Ayurveda University, Dehradun, Uttarakhand. I am working in the field of Ayurveda from last 20 years, and I am also working as an working editor for a peer-reviewed journal, that is ayushdarpanjournal.com, as I am running two portals, dynamic web portal, which is health web portal, and the website is ayushdarpan.com for Hindi and ayushdarpan.org in English. And this is my introduction, and I'm presenting in front of you to enlighten the great Ayurvedic Marma Science, as I am a master trainer of this science, and I have an experience of training many Ayurvedic doctors across the India as well as in the Southeast Asia. So I'm thankful to Dr. Sekhar for providing me a platform of webinar, which is Astanga international webinar platform, 36th 36th international online conference, Astanga Ayurveda. So I'm thankful to Dr. Sekhar and as well as the association APNA. Now I'm starting my presentation. Actually, what is you all know the definition of Marma science. According to medical definition, the science, the this science, this science is a science which touches the important vital points of the body, and you all know that they are vulnerable points, especially where vulnerable for trauma, and these points are known as the Marma points. As in the diagram, you can see that these are the Marma points of the head region, and these are very much of importance, as we all know that any injury in these points may lead to severe consequences, as I will state in my next slide. Any trauma to these places may lead to death or many other complications regarding physiological functions and anatomical configuration. As you all know, this happens during the war injury also. So you all know about these vital points, as modern surgeons also know these are some vital points. So just how these points are referred in our Vedic literature or in a holy literature. Just I'm giving you an historical background, that is Battle of Ramayana. You all know that the death or demise of the Lankadhipati Ravana was due to the injury in the Nabhi Marma by Rama, Lord Rama, as the arrow directly hits at that point, which where the prana of Lankadhipati Ravana resides. So this is a reference by which we can understand the importance of Navi Marma. Now you can I'm just moving you towards the other story, that is demise of Lord Krishna. So injury to his Padatala Hridaya Marma leads to his demise, and this is a very old story, the demise of Krishna, in which the Padatala Hridaya Marma importance is already we can observe the importance of these Marma points. And now I am just coming to the third in which Jesus Christ, according to the Bible, the demise of Jesus Christ is also due to the injury to Talhridaya and Manivanda Marma. So you can just go to all the three stories which are taken from the different holy books, and these three stories connect with the importance of the Marma points. And now I am just coming to the demise of Shravan Kumara. Shravan Kumara is a very obedient son of their parents, and he, as you all know, in Hindu mythology, this is mentioned that he is during the tour with he was holy tour with his father and mother, and during that tour, sometimes his father demanded to drink of water, and he just go near to in the bank of river, and he just tried to take water in a pot. At that time, the Shraddha was also present in the forest, and he confused that some deer is drinking water from the river, and in confusion he just hit the arrow, and that arrow goes and strike to the Sabani Marma of Shravan Kumara, and when he feel that this his vow, then Dasharatha feel that his arrow goes to the person, and he is crying, and he just want to remove the arrow, and immediately the demise of Shravan Kumar happens. This also gives an importance of that marma point that is known as the Sthapani marma. Now, just come to the current scenario. There is you all know that the cricket player Philip Hughes' demise is also due to the injury of Kancha marma. A ball hits in the neck region, and that leads to the death of demise of Philip Hughes, a well-known cricket player. And same happens in India also. The renowned cricketer, Indian cricketer in the 19th era of 1990, he died due to the injury of a ball hits in the Sankh Marma temporal region. So these are some recent stories by which you can understand the importance of these Marma points. Now, some interesting facts. We just come to some interesting facts. As we all know, in accidental cases, some people die without massive outside injury, but some people get extensive outside injury. They become healthy after proper treatment. It means that when vital points are injured, the person dies. So these vital points are very important for the survival of the human being. You all know that in day-to-day practice, you also observe that the head injury cases, some dies immediately, some dies after some time, but some remain healthy. This also indicates that there are certain Burma points which is an important. If that points is injured, the death may occur. But if that points are not in the not injured, the person becomes normal or healthy. So, historical background of Marma science. So many scholars of Ayurveda asks that there is no any description of Marma Chikitsa in our Ayurvedic ancient text like in Sushruta Samhita or Charak Samhita or Ashtang Hridaya or Ashtang Shangra. How you are elaborating this science at treatment aspect, in treatment aspect. So you all know that in Sushruta Samhita, Marma Nirdesh Sharira Adhyaya Sharira Sthana is the main chapter in which the introduction of these Marma points and how to safeguard and what happens if the injury occurs in these Marma points, as well as the detailed classification is explained in that chapter. And you all know that in Charak Samhita, the Trimarmiya Adhyaya is also the importance of three Marma points has been elaborated. So there is no any reference that these points can be used for treatment purpose. But just I am going to the historical background of Marma science. The Veda, as you all know, that the Veda are the treasure house of knowledge. And the Vedic medical science, we find a fourfold classification which is as follows. First one is the Atharvani, second one is the Angirasi, third one is the Devi, and fourth one is the Manusyaja. So these are the fourfold classifications of the Vedic medical science, which is more which is a more older than the new and modern, as well as the Ayurvedic medical science also. As how so I'm just explaining the historical background of different system of medicine. As you all know that Marma science and Marma therapy is the oldest way of healing in this world. How? Then Ayurveda has a history of 5 to 10,000 years old. Chinese medical system is also of 5 to 10,000 years old, and Arabian medical system is 1400 years old. But the modern medical science is less than 300 years old, while homeopathy and the Samuel Hahnemann's homeopathy is more than 150 years old. Many other folk medical systems were present in different parts of globe time to time, but they are not in existence today. So I'm just explaining these points that the Marma science and Marma therapy is more older and it is a more ancient than the Ayurveda also. So I'm just going to how this originate. As I explained that how it originates, just come to the Anganyas mantra. You all know that Mahamrityunjay mantra. Om Trayambagam Yajamahe Sugandhim Pushtivardhanam Urvarukomiva Bandhanat Mrityurmukshiyamamrutat. This is a sutra in which this is a Shiva Sutra in which uh, we are praying that our life becomes healthy and we enjoy all the things like dharma, artha, kama. And last thing is the moksha. Urva rukomiva bandhanat mrityur mukshya mamritat. This line explains that our demisal will be our liberation. May God bless us that we liberate without any pain. Janma, marana, bandhana, mrityu, mukshya mamritat. Like urva rukomiva, like the example is given that the ripened fruit just uh, separate itself from its counterpart without any pain. Such type of demisal we want, means such type of death we pray from the God. So the first reference in which the painless demisal is prayed uh, from the God is this reference, and this reference is very important. As you all know that Lord Shiva is Adi Yogi, and he also known as Rash Shastri, as well as the great Ayurvedic scholar, as well as the great Marma science and Marma therapy scholar. So actually, this Lord Shiva has originated all the treatment, as well as also there are references in which many diseases originated by the pitta prakopa of the Lord Shiva. I'm not going on that point. I'm just explaining that the Marma science and Marma therapy also directly linked with the Lord Shiva. Now just come to the picture in which Anganyas technique is given, demonstrated in this picture. You can see that this picture is an Aganyas technique. It is an important Vedic ritual in which we are touching our ang like this. So we routinely in our daily practice to pray God, we follow these Vedic rituals. So what is the importance of these rituals? Why we are touching these points? This is an also an important aspect. Another aspect is that when we blow a Sankha or Concha cell, we are blowing by creating positive pressure in our mouth, and that also directly relates with the stimulation of Marma points, and that will stimulate the Marma points of the neck region. So these all the Vedic rituals and all the rituals are just directly linked with the stimulation of Marma points. Uh, Another example is the blowing of a pipe in Buddhist tradition. You can see that in the blowing of pipe, and they also create a positive pressure in their mouth, and that will also uh, stimulate their Marma points of the neck region. So now I'm just coming to the Marma points. The Marma points are 107 in numbers, and they are distributed all over the body. And if you come to the numbers in neck region, in head region, they are 37. In extremities, they are 44. In back, they are 14. In thorax and abdomen, they are 12. So you just go through these Marma classifications and Marma points in Sushruta Marma Nirdesh Sharira Adhyaya. I'm not going to that detailed elaboration, but during the 3 or 4 days Marma training program, we are training the students, the doctors, the scholars to find out these points separately by classifying it, the upper extremities Marma points, the Marma points of the thorax region, as well as the back region, as well as the Marma points of the lower extremity. So just I am now just showing you in this slide the percentage of Marma according to the site and location. You just watch this slide. In this slide, you can see that 34% and the 21% is the Marma points of upper extremity, while maximum percentage is of the lower extremity Marma points, while chest and abdomen 11%, back is of 13%, and above neck is 21%. This is the percentage wise classification of Marma point. So Marma quality wise, if you see that total Marma points are 107, and the fatal means where if the injury is happens in that points, immediate death occurs. That is known as the Sadhya Prana Har Marma, as you all know. And 33 are delayed fatal. That is, the death occurs after some time, and that is explained as Kalantar Prana Har Marma. While the 3 hours fatal after foreign body removal, they are known as the Vishalyagna Marma. And the 44 Marma points are the disabling type category. That is, the injury occurs the Vikalata Vaikalyakar Marma, and the 8 Marma points are of the painful type. That is, there is some ruza, there is some pain when the injury leads to these 8 Marma points. It may persist some pain in the longer duration. So now just come to the percentage of Marma according to the structure. So as you all know that in the classification of Marma points, Mansa, Sira, Snayu, Asti, Sandhi is the classification of Marma point. So Mansa Marma, 10% are of Mans Marma, 39% are of Sira Marma, and 25% are of Snayu Marma, as same the 7% are Asti Marma, as well as the 19% is of Shandhi Marma. This is a classification as of percentage wise. Now just come to the distribution of Marma points. You can see that in the distribution of these Marma points, just I am showing you, just come to the upper extremities Marma points. First of all, the head. In this diagram, you can see that the Sthapni Marma, then you can see the Ansa Marma, then this is the Hridaya, this is the Urvi, this is the Ani, this is the Kurpar, Indravasti, Manibhand, Kshipra. And here this is Nabhi, Basti, and here 2 Marma points is of Vitap, as well as here is Janu Marma, and this is the Gulfa and Chipra. In next, in head region, you can see that there is an Adhipati Marma, Sankh Marma, Apang Marma, Vidhur Marma, and Fana Marma. Now just come to the Marma points of the back side. Trikatika, you can see Ansafalak, Parshasandhi, Nitamb, Kukundar, Katik Tarun, Guda, Urvi, Ani, Janu, Indravasti, Gulf, and also the Talhridaya in the lower part. And while in the, this is the Talhridaya of the palm, and this is the Talhridaya of the soul. So these are the explanation of Marma, important Marma points of the human body. So I just given a introduction of these Marma points in our body. So now just come distribution of Marma points in human body. So now just look the diagram in front. This is Sthapani, okay, and in the neck region there are Sirai, Matrika. This one is the Ansamarma, and here is the Kakshadhar. Here is the Apasthamba. Here is, you know, all know that there is a Hridaya Marma. Here Urvi, Ani, Urpar, Indravasti, and Indravasti, Vasti you all know, Navi you all know, Parsu Sandhi, I will explain it if time permits me. The Manibandha, Vitapa, Lohitaksha, Urvi, Ani, Janu, as well as the Gulfa and Chipra. And from the this view, you can see the Simantha, the Avarta, Sankha, Utakshepas, Vidhura, Sringataka, Fana, Apanga, Avarta, Nila, and in the lower extremity Kutsasira. So just from the back side, you can see that Adhipati, Simant, Trikartika, Ansafalak, Apalap, Brihati, Katiktarun, Guda, Ani, Kundar, Indravasti, and in the palm region, Talhriday, Kurch, Chipra, and Kurchasira. These are the Marma points. So, and same in the soul also, Kurchasira and Talhriday. You can see these Marma points. So, this is a distribution of Burma points in human. And this is the physioanatomical structure of Marma points. These muscles originate as well as insert from their counterparts, and they just they are just nearby to these Marma points. Some of the muscles you can see in this diagram: the pectoralis major, deltoid, biceps, palmaris longus, flexor carpi radialis, brachialis, flexor digitorum, lubrical. These are the muscles. You just go through this and you can understand. So I'm just keeping my lecture slightly practical. That's why I'm just skipping this slide. So now just come to the Marma points, some practical Marma points. So first of all, I just want to give you some idea that how you identify and how you locate these Marma point in your body. So first of all, I'm just going to teach you the Marma point of the head region. So first of all, just come to this point. I'm just giving you an example. I'm sitting in front of you and just roll your finger like this and just put your finger in the tuft of the hair. And this Marma point is known as the Adhipati Marma. The Adhipati Marma is specifically mentioned for the as a Marma point, as a king Marma point, as a master Marma point. So how you can stimulate? You just put your tough finger like this and just press it and release it, press it and release it, press it and release it, press it and release it. And the duration is 0.8 second. That is when we chant Om Namah Shivaya, then it is 0.8 second of time, and 15 to 18 times you have to stimulate it. And after that, this is the Adhipati. And this there are 5 Simant Marma. And just showing you where we are just if you divide our hair. So there is a suture, and this suture is of the Simanta Marma. So you can stimulate this 5 Simanta Marma in this position by pressing your fingers inside and outside, inside and outside, inside and outside, inside and outside. As you all know, there's a frontal suture, parietal suture. So the five important points are there. They are known as the Simanta Marma. So how you stimulate? Just put your thumb, this hypothelar eminence over here, and just press it by pressing this in this way. This way you can stimulate your Simant Marma. After Simant Marma, and there is an important Marma points which is situated in the back of the neck, that is known as Krikartika Marma. And for a stimulation of Krikartika Marma, you can just stimulate in this way, and all the stimulation should be of 15 to 18 times, and the duration is of 0.8 second. After Krigatika Marma, below this pinna, just behind this pinna, there is a Marma point. You just watch this point, and this point is known as the Vidhur Marma. And Vidhur, as you know, is a character of Mahabharata. So how you can stimulate? You can just stimulate in this way, this way, this way, this way. So uh, just put your finger like this and just give stimulation like this, and 15 to 18 times the stimulation should be, and the time duration is 0.8 second. And after that you just put your this the index finger in below the eyebrow, as well as the first finger in the temporal region. And this one is the Sankh Marma, and this one is the Apang Marma. And you can stimulate by pressing it, uh, pressing and releasing, pressing and releasing, pressing and releasing, pressing and releasing, pressing and releasing. All you can do all these things, stimulation 15 to 18 times, and 0.8 second is the stimulus time. And after that, as I already stated, the injury to Sthapani Marma leads to a demise of Shravan Kumar. So this one is the place of Agya Chakra, and just you roll your hand like this and put your finger like this, and you just stimulate these marma points like in this way. And this is the stimulation of Sthapani Marma. So this is the way by which we are stimulating the Sthapani Marma. And after that, just put your finger in this way and just give a pressure in the inner canthus of eye. And this is the stimulation of the Sringataka Marma. It is a very important and it is very effective to for treating allergies, different allergies, as well as the lacrimal blockages. And the next Marma point I'm just coming, this is the Fana Marma. Just you have to stimulate this with your small finger, and you just put your finger like this, and you can stimulate it this way. Yes, stimulation, just pressure it and release it, pressure it and release it, pressure it and release it. And after that, you can just, I already explained that blowing of concha, you just create a positive pressure in your mouth. So you just make this positive pressure, and by this you are stimulating, directly stimulating the marma points of your neck region. And another method is by protruding your tongue outside. By this, you are creating a negative pressure. So the marma points of the neck region should not be directly stimulated, and they are very vital and cautiously stimulated through indirect way by creating a positive pressure in turn, by blowing your mouth full with air, and as well as protruding your tongue outside and by creating negative pressure. So this is the stimulation of the marma points of the head region. I'm just coming to the marma points of the upper extremity, how you can stimulate these marma points. First of all, just put your hand 90-degree angle, this shoulder in 90-degree angle, and hand in 45-degree, and just place this in corner of your neck, and the middle finger where it comes, this is the marma point that is known as the ansa marma. So first of all, if the patient is or a person who is stimulating his marma point is a male, he must have to start it from the right side, while she is a female, so she has to start with from the left side. So this is the ansa marma. And after the ansa marma, you just come down, and I'm just coming to my slide also. This is your elbow joint, and from this elbow joint you just count 8 fingers above, you will get the marma point that is known as the Urvi Marma. This is the Urvi Marma. So just stimulate, press, just give support from this for these 4th finger and 5th finger, that is tongue. You just put in the Urvi Marma and just pressurize it and just leave it. Stimulate this. The time duration is, as I already explained, 0.8 second, and how much time you have to stimulate, that is 15 to 18 times. And from this elbow joint, 4th finger above, you just got another marma point that is known as the ani marma. This is the ani marma. So you have to stimulate this in this way, 0.8 second the time duration, and 15 to 18 times you have to stimulate this. And now come to what is the importance of these Urvi and Ani Marma, as already explained in this slide. They are very effective to treat the chest and lung disease, and so disease related with the thorax region, that is lungs and chest related disorders. And while just come to the next Marma point, that is very important Marma point, and that is known as the Purpar Marma. So you all know that this is the bony prominence situated in the medial side, and this is in the lateral side. So just below this prominence, one finger below, and this also from this one finger below, there are 2 points. One in known as Abhyantar Purpar Marma, while the lateral side point is known as the Bahya Purpar Marma. So how you identify these Marma points? Just put your thumb in the olecranon process and just put your middle finger in below, just below that, one finger below that prominence. And just put your hand in the straight direction and just stimulate this Marma point in this way. You just find out this point, and this is the Bahipurpar Marma. So you have to stimulate these Marma points in 15 to 18 times, and the time of the stimulation is 0.8 seconds. The same type of stimulation is also you have to do in the in the Abhyantar Purpar Marma also. So this is also below the bony prominence, one finger below the bony prominence. So you have to stimulate. So this is the lateral one, and this is the medial one. So you can identify this Marma points, and this is a very important Marma points which has an effect overall in the metabolism of the body. That means that this Marma point stimulation has an effect on liver, spleen, pancreas, digestive system. So you can manage, or you can maintain your whole digestive system physiology by stimulating this Marma point. So hence we advise the patient having an obesity or as well as underweight, both type of patient, the stimulation of Purpar Marma will very effective in the weight management. It is we already proved by different our clinical trials in our hospitals, and this is very effective also for controlling the blood sugar also, but not a single Marma point. In clinical aspect of Marma therapy and Marma science, we explain that which Marma points should be stimulated in combined way, not a single like Urvi, Ani, and Kurpar in combined way, either or only Urvi or only Ani. So I'm just giving you an introduction of these Marma points. So, and I want to you learn from my this webinar some of the identification of Marma points, and I hope that my lectures practical approach will more fruitful to you. So now just come to the next Marma point. It is below the elbow joint, forefinger below. You just come, and this is the Marma point that is known as the Indravasti Marma point. It is very effective, as all you know that Indra is the lord of rain, and Basti is a term used for the bladder. So this is a Marma point, very effective and very useful for all urine related disorders, prostate for men, UTI for ladies. So this is a Marma point which is directly related with our urinogenital system as well as the urinary bladder. So in old age or for prostatic enlargement or benign prostatic hyperplasia, as well as the incontinence of urine in females, PCOD conditions, this Marma point means Indravasti Marma point is very important. As you all know that in Sushruta Samhita it is mentioned that injury to Indravasti Marma leads to the Raktakshaya, means it is directly associated with the Raktakshaya also, and it is also connected with the erythropoietin, which is situated in the kidney, which is responsible for the blood formation. So a proper stimulation leads to the proper blood formation, while injury to this Marma point leads to the blood loss. So this is a very important aspect. Now just come to the another Marma point. You all know that this is a Mani Bandha. As you all know, this thread is already, there is a tradition to tie this thread in our Mani Bandha. As you all know, the Bandha is a term for lockdown, and money is term used for the glans penis as well as for this part also. So basically, this Mani Bandha is Marma is important for controlling the violent urges, the sexual urges, the anger, or you can in other way understand that this Marma point is important for controlling our urges, for relaxing ourselves, for de-stressing ourselves. So we just told the patient to rotate your hand in clockwise direction as well as in the anti-clockwise direction. By doing this, the Manibandha Marma is stimulated. So this is very effective Marma points. And now just come to another Marma points. How you find out these Marma points? You just make a 90-degree of in this way and just put your thumb in the web, in this web, and just find a Marma point that is known as a Chipra Marma. It is very effective Marma points for the endocrine disorders. So this is the Marma points of the endocrine disorder, and it is known as the Chipra Marma. And now I just give you identification of another Marma point. Just rotate your finger in this way, middle finger in this way, and just find a point which is known as the Talahridaya Marma. So by stimulating this Talahridaya Marma, the blood pressure is managed. Blood pressure should be managed. How? Another way is to draw imaginary line from here and just cut it from here, and you just find this Marma points that is known as the Talhridaya Marma. And this is very effective for all heart and brain related issues. Means I already explained that it is very important for controlling blood pressure. So just come to the points, that Marma points of upper extremities: Urvi, Ani, Kurpar, Indravasti, as well as so you just go through this diagram. I already explained you the Manibandha Marma, the Chipra Marma, the Talhridaya Marma, and the finding of the Talhridaya Marma by this picture. Now, how you self Marma therapy? I'm just explaining that Marma science and Marma therapy is not only for treating the patient, but it is very effective for self healing or for making our health physically fit. So the Marma science and Marma therapy has two aspects. One aspect for the prevention, as well as another aspect is for the treatment. So by how you can stimulate, I already explained that you are a healthy person, so you just start from the stimulation of the Marma points of head, and then after that you must stimulate your Marma points of the upper extremity. I already explained that for the upper extremity the female should start from the left, and while males should start from the right. The stimulation should be of 0.8 second, and you may correlate it with the Om Namah Shivaya chant counting it all. And this is also a one cardiac cycle, 0.8 second, and 15 to 18 times you have to stimulate. So just look at this diagram. The upper extremity Marma point, this is the Talhridaya Marma, this is Shipra Marma, this is the Manibandha Marma, this is the Purpar Marma, this is the Ani Marma, and this is the Urvi Marma. So just come to the organ effect of these Marma stimulation in the different organs. So as I already explained that the stimulation of the Marma points of the head region will affect on the pituitary as well as the pineal glands as well as the hypothalamus, while the stimulation of the neck region's Marma point directly affects to the spinal cords as well as the vocal cord. While the stimulation of the Marma points of the upper extremity in which Urvi and Ani has a direct effect in the respiratory system, while the stimulation of the Purpar Marma is directly related with the liver, stomach, gallbladder, pancreas, large intestine, small intestine, as well as the stimulation of Indravasti Marma is directly related with the renal system or the total urinary urogenital system. So just come to the same thing, the endocrine effects of these Marma points. Marma points has a direct effect on the pituitary pineal glands. Stimulating the Marma points of head will just control or just stimulate the Marma points of the pituitary gland and pineal gland as well as thyroid gland. So we can control the problems of thyroid, or we can correct the problems of thyroid, while thymus also, as well as the Marma points of the upper extremity, in which I already explained you the Purpar Marma stimulation is directly related with the adrenal glands as well as the kidney as well as the pancreas, while the Indravasti Marma stimulation is directly related with the ovary as well as the testes in the male. So just come to again the system-wise classification. The upper extremity Marma point stimulation is directly related with the upper respiratory tract, as I already explained the stimulation of the Sringataka, Fana, and as well as the neck region stimulation of the Marma point has an effect in nasal cavity, pharynx, larynx, while the Urvi and Ani stimulation is directly affects on the trachea, primary bronchi, and lungs. So you just know all these things I already explained you. So how Marma travels through these points. So this is a diagram. You can understand that when we give a stimulation, these Marma, the prana travels through these nerves to a certain area where there is a vikriti, or I can say that there is an obstruction of the movement. So they clear it. The obstruction will be cleared, and the things were directly corrected. We just we can observe these results instantaneously. And so in so many cases, in frozen shoulder and cerebral palsy, in different cases, we already observed these effects. So now I just give an example of the identification of Marma points of the same lower extremity. I already explained you the Marma points of the upper extremity. Same in the lower extremity. There is a Talhridaya Marma in the sole, and stimulation is also you can stimulate by identifying this Marma point. Same here is Chipra, and in lower limb also there is a Chipra Marma. While instead of the Kurpa Varma, there is a Janu Marma in this, that is Sandhi Marma. While instead of the Manimanda Marma in the lower extremity in the foot, there is a Gulf Marma. It is a very important Marma point by stimulation of Gulf Marma, and it is very effective for treating the rheumatoid arthritis pain as well as the osteoarthritis pain. It is very difficult to practically explain you during a theoretical lecture deliberation in a webinar, but I hope that I am just giving you an introduction. And if I could find the to make an interest to know about these Marma points, and sometimes we can plan a practical workshop of 3 or 4 days, and it is more beneficial for you people. Now just watch the Marma therapy for lower extremity. Just I explained you the Marma therapy for the upper extremity. Same type of stimulation in the Urvi Marma, that is also known as the Vabi Marma, Ani Marma, Janu Marma, Indravasti Marma, Kshipra Marma, and Gulpa Marma. So this is the Marma points of the lower extremity. I already explained you. So identification of Marma points, I already explained you how you can identify the Talhridaya Marma. Just rotate your middle finger like this and just put your thumb. There is a Marma point which is known as the Talhridaya Marma. This is a very easy. And in case of Gulf Marma identification, just look this figure, this diagram, and in this diagram you just watch. There is a middle malleolus, and in which we just make a key lock and key theory, and just we have to move this bone above this, and that will create a sparky sensation, and which stimulates the Gulpa Marma. It is a very effective Marma point. So just I'm coming to the handy facts. The Marma therapy is given by applying pressure, vibrating or pinching, or application of hot and cold pastes, oils and ointments at the Marma sites, on oneself or another person. These methods are different for different points. Shira Marma are very tender point. Very tender point. One should not press these points hard. Only massage and application of paste and oil is indicated over these points. Point situated over the upper extremity, I already explained you. The upper arm, forearm, and hand, lower extremity, thigh, leg, and foot can be pressed forcefully. Now, with caution, pressure and pinching of overlying skin and subcutaneous tissue is done for some Marma points in the back. So, subcutaneous ligaments and nerves can be stimulated by vibrating process. On other points, pressure is usually applied with the thumb and other fingers. In this case, pressure should not be given for long duration. That is, the thumb should not be kept pressed, but should be pressed rhythmically like heartbeat. I already explained to you. And now I'm just coming to the next point. The sandalwood paste, haldi paste, medicated oils, and ointments are usually used on points in umbilicus, in anus, neck, and head. In Panchkarma therapy, Shirodhara is applied on forehead and vertex. You all know this also stimulates the Marma points of the head region, through which we can put medicated oils drop by drop on Marma points situated in the forehead and vertex. In Marma therapy, First, one must be clear that Marma therapy is not acupressure, not acupuncture. All these therapies comes from the Marma science. And so, what is the difference between the Marma therapy and acupressure or acupuncture? We don't use any device like pencil, rods, pins, needles, seeds. We only use our finger. So, very important aspect. Marma therapy is different and acupressure is different. Don't confuse it with the acupressure. And the following table, you will find the location, including body elements and the therapeutic importance of the some important Marma points, like we stimulate the Chipra location. I already explained that in base of thumb and index finger and upper string, both it is present in the upper extremity as well as the lower extremity. So this is a snayu type of Marma, pressure with thumbs and index finger or vibrating with this in this way. This is the way. Same I have already explained for the Tal Hridaya Marma. This is a very important Marma point. Tal Hridaya Marma is of 4, 2 in our palm and 2 in our sole. Gulpa Marma in lower extremity, both sides of the ankle joints. Sandhi type of Marma, vibrate with knuckle, keeping the thumb towards opposite side. This way, we just create a knuckle. And Indravasti Marma, same I already explained, upper extremity and lower extremity. It is just you can understand that Indravasti, it is the 12 fingers from the this from the lateral from the wrist, and while if you count from the elbow joint, it is 4 finger. So this is the Indravasti, and pressure this is a Mansa Marma, and you have to stimulate it with your thumb and fingers. While an important Marma point, I detailed explained it. It is a Purpar, which is of upper extremity, either side of the elbow, both sides, it is joint, Sandhi Marma, pressure with thumb and finger. Thumb and finger, this way. So, and the Janu Marma, it is in the joint, it is the joint of the lower limb, and you all know this is the Sandhi Marma, joint Marma. So you can pressure it, which is repeated in the kneecap on either side of the knee. And so you have to, there is a two technique. One is the thumbs up technique and one is the thumbs down technique. If a patient is stimulating this Marma point, he has to use the thumbs up technique. And if you are self-stimulating your Marma point, so you have to use the thumbs down technique. So I'm just revising you. This is a Chipra Marma. You can see this is Chipra Marma of the lower limb. This is Tal Hridaya Marma, and this is the Gulpa Marma stimulation, and this is the Indravasti Marma stimulation. This is the Purpar Marma stimulation. So I'm thankful to all the viewers and all the participants of this webinar, and again thankful to Dr. Sekhar for providing me an opportunity to present my lecture in concise way. Marma therapy and Marma science is a great science, and it is an effect in the preventive aspect also, and we are also training to scholars the Marma Pranasana. It is an extreme important branch of the Ayurvedic science. It is for healing as well as for not only for healing purpose, but it is also for maintaining our health. So I wish that you, if in my lecture you find some tips about and some practical tips about the Marma science, which enlighten the great science, which is and if you have an interest, we can plan a practical workshop training program of 3 or 4 days. It is not possible to concise the whole of the Marma science lecture in a webinar or in a 1 hour or 1.5 hour lecture. So I hope again, thanks. I'm thankful to all of you. Namaskar.